It is an electrical shock applied to the brain. I don't think it worked for me. I would prefer if I'd never had it in my life. Many, many times, all I wanted to do when I woke up in the morning was to die. That's all. So this is a big improvement for me now, to wake up and be happy. I would have loved to have had a career 20 years ago. My career really only started 5 years ago. I think I also would have preferred to have married and to have a family. And that was another thing that never happened. And I think I could sit here for hours telling you about things that never happened. So I think the focus should really be on the things that did happen. This is 30 years ago, and sometimes I get mixed up about what happened next, or when this happened, or when that happened. I was about to start work in a prestigious advertising agency in Dublin, and we went on holidays, my mother and I was due to go to this new job when I came back. And while I was on holidays, this sounds crazy, but it did actually happen. I had a gun pulled on me, and I freaked. But I said, oh, because of my, don't tell anybody about this. This is my secret. I told no one. And I freaked, and I flipped, and my mother couldn't understand what was wrong with me. And when I came back, I was taken immediately to John O'Gott Hospital. At that time, they didn't have the medications that they have today. They had really very, very little to treat patients with. ECT was part of that toolbox. My psychiatrist was faced with a really horrific situation. He was dealing with a young woman who would tell him absolutely nothing and was behaving in a most bizarre manner. And he was only doing his best to bring this person back to normal. And he had very, very little to do that with. The way I felt was, I've no choice in the matter. So, what can I do? If I tried to run away, I'd be stopped. If I tried to get away from this place, I'd be hemmed in. I had no choice in anything. I had no choice in the medication. I had no choice in the treatment. None whatsoever.
Why is it that some psychiatrists feel they need so much control over people? And you administer a procedure to someone against their will. I mean, how in God's name could that be beneficial? How can you do something to a person against their will and still be in a relationship with them where you as a healer are supposed to help them? Trust has completely broken down.
They would give it to you first thing in the morning. You would go in to the room, and you'd lie down on a bed, and they would inject you in the wrist with a muscle relaxant and I think an anaesthetic, and you could feel the drug going up your arms, like an ice cold feeling going up through your veins, and then you would be out of it really, so you wouldn't really feel another thing. But what I do remember specifically is being almost in a totally collapsed state and being unable to walk after it. And they would almost carry you to have your breakfast, and they would insist that you would eat a piece of bread and a cup of tea, and then you would go to bed for the day. At the time, possibly they gave far more ECT than was necessary. I don't know. You need to be a medical person to know that. And possibly they were giving ECT to far more people than they would today.
We use bilateral ECT, so you're placing one electrode either side of the head. So if you imagine that's the head, these are my ECT paddles, one electrode either side of the head, and there's a green light comes on the machine, you know that you have good contact once that green light is on. So you shoot, it's preparing to administer, and now it's delivering the electricity to the head. And then that's it, and that's it. At that point, the client, if it's worked, you will see them physically have a convulsion type episode. And it's really a modified version. If you've ever seen anyone have an epileptical type seizure, it's a very modified version of that, because we do give people muscle relaxants beforehand. That's so that when they do have the seizure, the muscles are that more relaxed that they don't tense too much. Back in the dark age when they didn't give it, fingers would break, any long bones would crack, your intercostal muscles would be pulled and you'd kind of break ribs. That is, thankfully, is a thing of the past and doesn't happen at all anymore. Sometimes we have had clients who the convulsion lasts for maybe 1 or 2 seconds and you think it's not worked, and then you look to the screen and they're having an absolutely therapeutic seizure here.
There's no way a neurophysician would stand over electric shock treatment on the basis, for him, he would be looking at the epileptic fits that occur as a result of ECT. And he would be thinking, well, I have a discipline and I'm trained in a discipline which tries to prevent epileptic fits. Why is there a discipline in medicine actually causing epileptic fits?
And my opinion about ECT is that if ECT saves one life, if it stops one person from committing suicide, well then it is a valid treatment. Unfortunately, it wiped out good memories. It wiped out my teenage years. I was shown photographs of me at a wedding. I was shown photographs of me at a party. And I had no idea where it was, when it was. I couldn't even believe that I'd been there. So there was dramatic changes in my memory. And I disliked the fact that happy memories were erased.
So memory loss is for me a huge, it's unspeakable when you think that the mind, if you like, memory rather, is the place where the mind calls home. So when you're impairing memory, you're actually impairing the identity of the person.
I do believe that I lost the person that I was completely. And there weren't enough people around to remind me of who I was. So I lost myself completely. Lost touch with friends, lost touch with everything. Social groups I'd been part of, things I used to do, lost touch with the lot. I started to study piano when I was 7, and no, not 7, I was about 9 or 10. And from then onwards, the piano was a big time part of my life. I practiced for an hour a day, and before examinations for 2 hours a day. After ECT, I just dropped everything. It was just too hard for me to do, too hard to get down to do it. And the piano was my safety valve. It was where I could go and release myself from all the tension in my life. And I think my mind and body got used to that. And then without it, it had nowhere to go for that release. So it was a big mistake to give up playing the piano. I wouldn't blame ECT for the fact that I don't play the piano. It didn't help at all. But I don't believe it was the cause. It was all the other things combined. The hospitalizations, the medication, the disruption to my life. My life was severely disrupted, not once, but many, many times due to my illness.
We don't somehow care about people who develop psychological problems. It's like as if we blame them. It's like as if there's some kind of a punishment. I mean, why do we do this? Why are the psychiatric population different?
At times I felt my right to free speech was taken from me due to the fact that I'd been labelled with a mental illness. I felt that nothing I could ever say, think or do would ever be accepted because of my psychiatric history. It's only since I started working in an environment where there was true equality did I begin to realise that I'm equal. I have a story to tell as well, you know, and you've no right to dismiss my story just because it's different, or dismiss me because I'm different. But I try to be as much to fit in with people. I do not allow myself to behave in a manner that is odd or doesn't fit in with people. So that's how I do that.
Do you have any bitterness about the past?
Oh, lots of it. Loads of it. Loads of bitterness for everything and anything. But that's something you have to work on yourself a lot. And I just don't go there. The thing is to park that as best you can and move on.